Good afternoon and welcome. Today's program is Texting and Treatment Settings, How to Ensure You're HIPAA Compliant. I'm Julie Miller, Editor-in-Chief of Behavioral Healthcare Executive. Today's program is sponsored by Lua. Thank you to our sponsor and to everyone in our audience for giving us your time and attention today. Before we get started, there are a few housekeeping details we'd like to go over with you. Please use the Q&A box below the slides to submit a question or a technical issue at any time. You don't have to wait until the end of the presentation to submit your question. To download a copy of today's presentation, please click on the link in the Resources area to the right of the slides. And finally, for those of you who tweet, please tweet along with us using the hashtag BHELiveWebinar. At this time, it's my pleasure to introduce our speaker for today. Michael DeFranco is the founder and CEO of Lua. He began his career with an enterprise software company that provided security solutions to the U.S. government and Fortune 500 corporations. Since then, Michael has built databases to help launch Bloomberg Government and is a participant of the United Nations World Forums on Education. He also serves as a New York leader of the Foreign Policy Initiative. Michael, thanks so much for taking the time to speak with us today. And with that, I'll turn the audience over to you.
Thanks so much, Julie. Hey, everyone. As Julie mentioned, my name is Michael DeFranco, founder and CEO of Lua here. We provide HIPAA-compliant communications to the healthcare industry with a particular focus in the behavioral healthcare side of the industry. And today we're going to talk about our work and how you can stay HIPAA-compliant in your communication within your treatment and recovery centers. So to start off, we're going to go over some of our objectives. I'm going to try and keep it fun. First, I'm going to summarize HIPAA compliance and regulations related to text messaging and SMS. We're going to identify the risks of using non-compliant communication in the workplace. We're also going to talk through the fun part, which is how HIPAA-compliant texting can increase both productivity and collaboration while improving patient and family experiences. So to start, we wanted to do a quick poll for the audience, and what we're trying to do here is understand, who you are texting with today while you're at work. And so this is going to be anonymous, but if you could jump into the poll here and let us know who you are texting with. All the above is what we're seeing today. So a lot of healthcare providers internally coordinating, communicating between their staff, communicating directly with their external providers, directly with patients and with patient family members as well. And I think the one thing we can agree here is that text messaging and SMS is widely used today. And, the reason for that is because of, how usable it is. It's something we're using every day in our personal life. Today we're not emailing with our friends when we're making plans on the weekend or, emailing with our loved ones or family members. We're resorting to SMS, and there's a variety of reasons why, I think that the device saturation across this country is really close to 100%. They are giving away smartphones almost for free at this point with your plans, and as everyone is using more consumer texting in their personal life, when you come to work, it's just sort of a natural extension of that. Yeah, and so at this point, Megan, if you could publish the results from the poll, we can take a quick look at that. Yeah, so great. What we're seeing here, is a high number of, actually number one is all the above, and that's really what we're seeing here. And that's actually a great thing. So, what we would imagine is not everyone has a HIPAA-compliant tool in place yet. They are just using SMS. But as we see here, there's a wide number of people, not just using texting for internal communication, but also directly with their patients. And what's great is that there are solutions out there that can allow you to both internally and externally, securely and in a HIPAA-compliant way, coordinate and communicate. So we're going to move on at this point and just go through some mobile healthcare stats that we're seeing today. So it is, the preferred workflow, as you just saw there, for healthcare providers across all specialties, but specifically behavioral and addiction treatment. Now, everyone does have a phone near them at all times. Faster and better communication drives better healthcare outcomes. It can reduce mistakes, and it can just make for an overall better experience for both the patients and their family members. Financially, it does improve administrative and clinical workflow, and also helps to streamline recruitment and marketing efforts. And so here are just a few stats from the peer-reviewed American Nurse Today and a study from last year. So what we're seeing here is that more than 80% of medical professionals are using personal devices in the workplace. 74% of healthcare executives say that mobile health can be dramatically improved. It can dramatically improve outcomes by just giving people greater access to medical information. And surprisingly, 62% of accidental deaths and 80% of medical errors are actually linked to communication failures. So implementing a secure messaging platform that everyone has access to can really help streamline everything you're doing internally. And we covered a bit of this, but the reasons why we're texting is that it's both fast and convenient. It's more likely to be opened in a short amount of time when you compare it to the open rates of email. And with the right secure messaging partner, you're also able to check read rates, see if people have opened that message or not. And currently within the treatment setting, everyone from healthcare providers to recruiters, admissions, caseworkers, administrators, and patients and their family members are texting, as we just saw in that poll, to coordinate care. And so providers continually need to collaborate on treatment plans with the members of their care team. So whether this is internal communication or discussing the patient with another provider outside the organization, like referring a physician. And so quickly sharing that electronic PHI or protected healthcare information and any sort of other sensitive information is necessary in order to facilitate a treatment plan. And so, as we saw, it is something that is being heavily used, and it's, estimated by HIPAA Journal that, again, over 80% of medical professionals are using it. So, while texting is fast and improves communication, if you are using consumer tools like iMessage, like Google Hangouts, Facebook Messenger, WhatsApp, or just, SMS, you are at risk to being exposed to HIPAA investigations and fines. So we're going to break this down for you, but HIPAA rules can be a bit vague and confusing. And so to really start at the beginning, it's not the texting itself that's the violation. It's the text messaging or transmission of identifiers of a patient. So any protected healthcare information or PHI, if it is found in a text message, that's subject to up to $50,000 per fine, or a $50,000 text fine per text. And so that can begin to add up quickly. We're going to continue to break that down a bit. So we know, many people in the industry are trying to stay secure by using initials or code words. But errors there can be catastrophic, and if you do identify something that is just the same as if you initially texted it. And the other part of this is trying to separate your personal and your work life. So as we are texting more and more in our personal lives, it's nice to be able to have a work inbox and a personal inbox for text messaging, just like we have for email. And you don't want any sort of patient-related text messaging in between texting with your loved ones or your kids or your friends. So let's sort of put them in two different boxes. And so in order to actually get the benefits of texting for your treatment center, you need a HIPAA-compliant messaging solution, specifically that can sign a BAA or a business associates agreement with you. So for instance, our organization, LUA, has been audited. We go through an annual audit with a third party. What we can provide to you is both, the certification that we've been audited, and we can sign a BAA with you. So it's something that, no matter what provider you're choosing, you should ask for off the bat, because that's sort of the thing that HIPAA is looking for there. So while, keeping your personal and work conversations are important, the biggest thing is make sure that you're following the right policies here. And, once you have something like this in place, you can spend more time focused on patients and not worrying anymore about HIPAA fines and breaches. And so to break down it a bit more, the final high-tech rule that came out in March 2013 and introduced a new HIPAA texting policy. And so as I mentioned before, what this is focused on is including third-party service providers. That anyone you're using to transmit electronic PHI, you must have a BAA signed with them. So, well, I'm sure most of you or everyone here has a BAA signed with their email service provider. It's really no difference for text messaging. And so, the key things that high-tech here is focused on is authorized access. So access to PHI must be limited to authorized users, really yourself and any sort of administrators who have access to that. people, it's authorized to people who are required to access the information to do their jobs. Another piece of this is auditability. So a system must be implemented to monitor the activity of authorized users when accessing PHI. So this is another reason why using consumer apps, isn't really acceptable by HIPAA, because you do need at any point to audit and show that internal and external communication that you're having. And so the third piece of this is encryption. So you do need to be certified by HIPAA to transmit this information. You do need the right firewalls and right encryption levels. And basically what we're doing here is making it unusable for that transmission to be intercepted by a hacker or any other third party, like employee inadvertently seeing that text. To go in a bit deeper here, the HIPAA definition here is also around willful neglect. And so what that means is consciously or intentional failure or reckless indifference to the obligation to comply with the administrative simplification provision violated. So really what it means there is, HIPAA is at this point, pretty transparent. It just means if you have a HIPAA email system that you're using, you know that you need to encrypt your messaging. So if you're willfully neglecting that and transmitting information over text message, that's kind of where they nail you here. And so as I mentioned before, if there is a breach of electronic PHI, that can earn your organization a maximum penalty of $50,000 per breached data item per text message. And another stat here is actually 60% of HIPAA violations to date have actually been reported by the patients themselves, that they feel that their information is being mishandled. And so another part of this within HIPAA, it's called the omnibus rule, and what this is about is about that BAA. So this rule really states, if you are using a third party like pagers, like email, like text, you do need a BAA business associates agreement signed with a third party provider. And so to really jump in here to why using iMessage and Apple or your Android device to text is not authorized by HIPAA. Specifically for iMessage, they do use end-to-end encryption, so meaning the only the intended sender and recipient can view each message. However, and so this is the important part, Apple actually keeps a cached version of messages sent using iMessage, which can be accessed either by warrant or by a potential hacker. And so for the right HIPAA compliant tool, part of our audit is to show that we're not ever keeping a downloaded cache of the message on the device itself. So it lives inside the Lua system, or that third-party system that you're using, but it's never actually downloaded to the device. And so what that means, if you're using the right service provider, if one of your employees inadvertently leaves their phone in a cab at a restaurant, and someone picks it up, and they're able to access some of the last text messages that came through. If you're using a HIPAA-compliant system, what you can do is you can press one button on a back end that should be able to remotely log out that user and wipe their system. If you are using iMessage, you're not able to do that. And so it's specifically the fact that Apple is keeping that cached version of the message. And that's something, anyone here needs more clarification on. Happy to discuss that offline. But that's really why, using iMessage is not protected by HIPAA. And the other piece of that is that Apple does not sign BAAs with any third-party organizations. And that's also, just as important there. So what we're going to do here is just, talk about the other half of this, and so that's the Department of Health and Human Services. And so I think everyone here is most likely familiar with the 42 CFR Part 2. And what they did in March 2017 was actually issue the first update in 30 years. And so what this came to was part of an effort to allow providers to take advantage of new models of care that promote value and team-based coordination. And so to quote, this a little bit, the effort here was to modernize the confidentiality of alcohol and drug abuse patient records, regulations, and facilitate information exchange within new healthcare models while addressing the legitimate privacy concerns of patients seeking treatment for a substance use disorder. These modifications also help clarify the regulations and reduce unnecessary burden. And so what this is really trying to do here is protect your patients. If they're coming, especially if they're coming willingly into a treatment center, there's another level of enforcement here to ensure, that the electronic PHI about, what their addiction might be doesn't get to a potential, employer or current employer in the future. So, there is another level here of protection as you are working, with recovery and alcohol and drug abuse patients. And we just want to make sure that they're coming forward, they're getting treated. We want to make sure that we're not affecting their work and personal life, because sometimes the damage is, very hard to fix in either the short or the long term. And so a big piece of this is also the patient consent. So one high-level provision of the rule is around signing disclosure agreements where the patients can specify who can access their data and what type of data can be shared. And so, what they can request a list of individuals who can access their data. And so a big piece of this is if the patient created this list of who can actually access it, and in the future, you want to be able to audit and ensure that no one else is discussing any sort of communication or PHI about this patient. And you can do that, very transparently and very easily with 1 or 2 clicks with a system like Lua here. So we're going to move on here to the next page. So, just going to spend 1 or 2 slides just quickly going through some of the current HIPAA violations from the last 2 years. There's a lot of data of this online, and when we email this out, on the next slide here, we have a link to keep you up to date with what's going on there. But 2016 had over $22 million in settlements. And the big thing here is more and more texting is occurring. This is becoming more and more of a regulated and tracked issue. But, one large instance here is New York State Office of Mental Health, putting 22,000 patients at risk due to a breach here. And so, there's a lot of ways that patients' information can be breached, via phishing text, via email, but for text messaging, keeping your communication compliant can really put you in a different bucket, so you don't really have to worry about this anymore. So between 2012 and 2013 alone, there's over 2.6 million patient records that were exposed as a result of insecure device use. And, all these stats are coming specifically from the mental and behavioral healthcare industry. And so the solution is not to outlaw mobile devices in the workplace, but rather to work together to put together a mobile device security strategy and use HIPAA-compliant tools. And so to just look at, where we are, in March 2017, there's already $16 million in fines that have been handed out, and, we're a little over half the year here. So, this isn't what providers should be worrying about. Fines can come at any time. But what you want to do is stay protected without hindering efficiency. So again, this isn't about outlawing devices. This is about using secure messaging to, 1, stay compliant, but 2, increase productivity in your workflow day to day. So this first half is really covering the rules and regulations of HIPAA. The second half, which I think is, the really fun part, is actually going through, how some organizations across the country are currently using HIPAA-compliant messaging to coordinate and communicate and increase efficiency across our workforce. So we take one of our customers, La Hacienda Treatment Center. They're using Lua for a variety of reasons. What we wanted to focus this use case on was the communication externally. So as we saw in the poll earlier, large portion of everyone there is communicating on a very, 28.3% are communicating on a regular basis directly with their patients, and, another 60% to family members. And so what La Hacienda is doing here is they're using Lua as a HIPAA-compliant secure solution to communicate day-to-day with outside colleagues, with patients, family members. So one use case here is specifically communication between their alumni director with their alumni to check in, maintain a long-lasting, supportive relationship with them. So what's nice about a party like us is we're able to provide the ability to send a HIPAA-compliant message to an outside user where we don't require them to download the app. So what they're going to get is they're going to get an email or a text message with a secure URL in there. And so when they click that, it's going to open a web or mobile page where they can conduct a one-to-one chat, upload and share files on both sides. That URL will eventually expire. So for the patient, there's no cumbersome patient portal login that they have to remember. It's one click, it's frictionless, and we found a lot of success, and both parties are really enjoying that. And so a big piece of this is keeping an open line of communication to keep the patient on track, celebrate wins and accomplishments in between sessions. And what we're seeing here across our organizations is the ability to strengthen the bond between the provider and the patient and make your treatment more effective and allow that patient to have a more direct and secure line of communication with everyone. And so, the second use case focuses on enhancing the workflow with files and photos. And so today, if you are using your iPhone, for instance, to take a photo or a video, you inadvertently are having that sync into your iCloud, which ends up at your laptop at home. Your tablet is going cross-platform. And so when you use a HIPAA-compliant system like Lua, you're able to take a photo from right within the app. So when you do that, it'll stay inside the Lua system. It will never download to the device. As mentioned earlier, if someone's leaving the organization, with one click, you can remote wipe them. And basically, as an organization, you have full control and management over any files or videos or photos that are shared. And so, sort of going through one of our customers and their workflow, they're able to share everything from the patient notes to timesheets, reports. If you do have employees in the field, check-ins with them, quickly sharing treatment care plans, and as mentioned earlier, provoking access. And so a big thing to keep in mind here is when you're using a secure messaging platform, many times you're going to have a web portal as well. So this isn't just a mobile tool. You can work all day off your laptop and upload and share, a spreadsheet or a PDF right from your laptop, send it to a group of employees, and they'll receive it on their mobile device. So we'll get into that in a few slides from here about that cross-device functionality, but that's really key here, especially when you think about the file and photo workflow. And so, a few examples of how people are using this. Recruiters and marketing professionals can communicate compliantly from referral locations, other clinical settings, to their central office. And again, the key here is that, that file management won't ever end up in personal storage on the device. As an organization, have full access and auditability of that. So as an organization here using us, what they're doing here, and where we're going to focus this use case slide on, is group messaging to coordinate care. And so what this does here is connecting administrative staff and providers to coordinate around scheduling, around care plans, really to provide best and most adequate care to their patients. So again, thinking about removing workflow or work-related text messaging from your personal iMessage into an actual app. It's a lot easier to go from a one-to-one to, a 10-person chat back to a 1-to-2. And again, keeping everything coordinated and communicated. It really ends up being your work text messaging inbox, which is really nice to separate the two. So we're seeing providers able to develop groups around specific patients, keeping everyone informed and collaborating. Outside of that, you're able to coordinate schedules, especially as shifts are changing, care instructions, as mentioned in the last slide, documents and photos. And so really keeping all your workflows centralized and especially simplified in the same place. And, through our work, we understand that treatment and recovery centers can experience a high turnover rate. So what you're able to easily do here is manage employees as they're leaving, as they're coming in, onboarding them, and assigning them to the right patients and coordinating care. So a nice quote from one of our customers with this workflow is that Lua is helping them provide better continuum of care, client care, by allowing their teams to quickly and confidentially communicate with each other. So really, you're not missing a beat, allowing to provide the best level of care possible. And so here, we really focus on accountability. So the idea here is, when you send a photo, a video, a message to someone, you can see real time who has and has not read it. So if you send a group message to 10 people, you can see, Michael and Julie have read the message in the last 2 minutes, but Rebecca has not read it yet, and Matt has read the message but hasn't actually looked at the file yet. So there's multiple levels of accountability that you get to the right secure messaging partner. And a quote that we've found here is that secure messaging helps our agency by allowing security and peace of mind with the convenience and inevitability of texting in today's technological society. So unlike texting, secure communication solutions like this provide total accountability and transparency of all communication. And so again, it's messages, it's files, it's even being able to launch calls, one-to-one or group calls from the same application. and easily, again, follow up with those in real time who haven't opened it. So if it's something that's time sensitive, you can look into a message, see, 3 people haven't opened this file yet. We need them to either turn in a timesheet or, fill in some information here. You have that real time accountability to look at who has and has not opened or read that. And so, we are now at our final use case here. And the big focus on this is cross-device management. And so key here, a lot of the secure messaging partners in HIPAA are able to provide tools that can be used off your mobile device, off a tablet, off your laptop and the web, so cross-platform functionality. So it's not, again, just a mobile-based tool. You can really use this on every device you're using in the workplace. So, some case studies and use cases we've heard, marketing and recruiting, being able to easily contact case managers and admissions when they're quickly onboarding new patients. Administrators and case managers having the ability to distribute important policies instantly to the entire staff, and having certainty that they've been able to read it. And for employees, being able to share patient notes, audio notes in real time, documents, and submit documents to their administrators. And the big thing also is just having a unified and simplified directory of everyone on staff. So sometimes it can be overlooked, but with the right solution, like Lua, you're able to have an internal directory where we break down everyone in the organization by department and position, so that either for a new employee or employee that's been there, for many years, you don't have to add everyone to your personal directory. You're going to have everyone's name there. Everyone has full access to that. It's going to have, the first name, last name, a photo of them, their title, not just the ability to message them, but also call them. And so having that interactive and rich directory just leads to better patient outcomes. So, the main point that we're trying to point out with these different use cases that while, compliancy and, making sure that all your communication is encrypted, there's a lot of benefits and outcomes that come from this. So it's not just staying secure, it's really being able to move into the future and just, coordinate with speed and ease. So before we go into, where we're seeing the industry moving, just as sort of a recap here, within behavioral health care, the use of secure texting offers many gateways into patient care. Compliant messaging with providers, with patients, allow for, fostering better relationships, staying up to date on patient progress, and improving scheduling and coordination efforts. An open line of communication can help to either keep a patient on track, celebrate their wins and accomplishments in between sessions, and this can really strengthen the therapist-patient relationship. The hope there that treatment is more efficient can really help the patient better stick to their regimen, for those lasting success stories. And lastly, but really most importantly, just giving that peace of mind that all your communication is HIPAA compliant. Systems like Lua, are $8, $7 per user per month. So we're not really talking high costs here. And so to weigh the pros and cons of deploying something like this, it's relatively inexpensive. It's simple to deploy. Training is simple as well, and it's gonna from that moment on be able to run an audit at any point, onboard and offboard employees very quickly, and keep that patient really happy and feeling that there's a support system around them, that they're not just by themselves. And as you all know, it's not just patients in a vacuum. Many times it's close friends and family members that want to be part of that fold, and giving them the peace of mind that they have direct access to the providers, that they can check in, make sure that things are going well, and that is not being intermingled with the rest of your personal texting life. So where we're going to go from here, just spend a slide or two talking about where we're seeing the industry evolving. And this is stuff that we're finding really exciting. So as I touched on in the last slide there, where we are evolving our own platform is actually deploying the Lua app to patients and their family members. So, the earlier use case we talked about, that patient wouldn't have to download the app. They'll just get a text message with the URL in that. That's a very frictionless way to coordinate care and keep it compliant. What we're seeing a heavy demand for is actually to have group messaging, so not just the patient, but family members, friends, in the app with their healthcare provider. So it's something that we've developed in the last few months. So now everyone can download Lua on the patient and family side. They can access it off their computer, off their phone, really what we're providing there is peace of mind for that family and friend support system, transparency and accountable communication, increasing efficiency. If there's decisions that need to be made in a short time, you don't have to sort of scramble and try and find that individual's contact information, have to, text message a administrator in-house to try and pull that record up, or search through your text messages to try and find, that patient's loved one or their family member, their mother or father. So again, you have all that, not just ability to message but call from the same system, freeing up time, saving money, and one of the big use cases we get here has nothing to do with security. It's just confirming appointments, making sure that someone actually read that message. If they haven't gotten back to you, at least they've got the message. But just confirming appointments, sessions with patients and families, routine things like that comes out of deploying enterprise-grade messaging like this that sometimes is overlooked, but we find just as helpful as sharing patient data. And again, the number one thing here is that patient experience and that coordination around them. So you don't need to see the amount of coordination that's occurring around them. That's really the best service you can provide, is where they feel just a lot of love, a lot of support around them, but there is a high grade amount of messaging and other infrastructure that's supporting them around there. And so what that does is improves retention. People can say they had a really good they had a really good experience at the treatment center. That group is very organized. Whenever I had a question, it was answered quickly. That's really the support system that can be built around the right kind of communication tool. And so, just like you're using highest class everything and equipment that you're buying physically for your treatment center, we would say do the same thing with the technology that you're deploying. And so the other piece of this that we're really excited about is, we're actually in the last legs of deploying telehealth and video conferencing. So being able to seamlessly escalate a one-to-one or group message into a HIPAA-compliant video chat from the same platform is really sort of, the next generation of software that we're building here at Lua. So being able to do that both off your mobile device and the web is really nice. And again, having that auditability just like your messages from the same place. And so a note there that, it isn't being as highly regulated, but consumer apps like FaceTime aren't HIPAA compliant. We're not at a stage where we're seeing any fines coming out. But, better to be safe than sorry and keep everything in the same place. And, if you're audited, say, here's the X amount of communication we had around this patient, here are the video chat sessions that we had, all fully compliant, all in the same place, both, peace of mind there, but also, providing a next level of support for that patient. And so both for scheduled video chats and also ad hoc, we see a lot of the time, a lot of times, patient really doesn't want to get on the phone, they don't want to email, they just want to chat. But you get to a point where it seems like you should be face-to-face, but you're not, in the same area, or that's just not a possibility, and there's something that's escalating. So we built this from a lot of demand that, in the middle of that one-to-one chat with the patient, let's just press one button, get on a video chat, really talk through this, face-to-face, and give that patient, a better possible outcome there. And it's also for remote monitoring as well on a scheduled basis. But, this can be both for direct-to-patient, internal communication with outside providers, any sort of affiliates or colleagues as well. And so it's something that we're in the last stages of launching our beta program around. But, really want to thank everyone for their time today. At this point, I'm going to hand the control back over to Julie, so we can start fielding some questions and answers. But thank you all for spending the time today, and look forward to answering some questions from everyone here.
Great. Thank you so much for your insight. And we have had a number of questions come in from our audience, but I would like to remind you that you can use that Q&A box below the slides to submit a question at any time. And remember, if you're interested in downloading today's slides, they are available in the Resources tab to the right of the presentation window. All right, let's dig into a few questions here. Can you tell us, would you say the industry is doing a good job of HIPAA compliance, or do you think there's still a lot more work to do?
So what we're seeing is that, treatment and recovery is quickly growing in the country right now. I think a lot of treatment centers are opening rapidly, and not everyone has their security infrastructure in place. So I would say most organizations we speak to don't have HIPAA messaging in place at all at this point. There are text messaging, whether or not they're doing it with abbreviations or codes, or just not really understanding, the violations that could be occurring. What I could say is, people are utilizing technology at a great level in this industry, but we can definitely see improvements like deploying systems like this or others to help solve that gap.
Great. And can you tell us who is enforcing the high-tech and HIPAA rules regarding texting? Is it strictly a complaint-driven process, or is there regular enforcement?
Yeah, so a combination. So, 60% of HIPAA violations we've found to date are actually coming from patients reporting it, feeling that their data is possibly being insecurely handled. So it can come at any point as a result of that. But we are beginning to see more and more regular audits, especially as treatment centers grow. And, this is sort of a new emerging part of the industry. Text messaging is still, a bit in the gray world, but as more and more people are using text messaging in their consumer life, these auditors are coming out, mostly from HIPAA, looking at people's infrastructure. And what we're seeing a lot is, them sort of coming in and asking for, transcripts of text messages. If an organization doesn't have the ability to self-audit, we've seen them go in and ask, for the top providers to provide their personal text messages. So it's a lot easier just to be able to press one button, run an audit, and hand it over.
Okay, and someone in our audience is asking, my Android phone says it is encrypted under my settings. Is that HIPAA compliant? And
that's a great question. So short answer is that it's not. So, for either Android or iOS devices, most of them at this point are using end-to-end encryption. WhatsApp is as well. But the big thing with HIPAA is that you have signed a BAA or Business Associates Agreement with that third party certifying that you are HIPAA compliant. So there is storage, and specifically earlier in the presentation I went over the caching that iMessage has. And I believe Android is the same in that, caching just means that, that text message is on multiple devices and or it lives on the device itself, so that, someone picks up a phone and you've lost it, and they have access to your phone, they could possibly pull out the metadata and see the text message stream there. When you use HIPAA regulated third party, usually you can, with one click, run a remote wipe or deactivation of that tool and remove all the cached messages. So that's a very particular and specific example for text messaging. So end-to-end encryption alone doesn't mean it's HIPAA compliant. You actually do need to be able to sign a BAA or Business Associates Agreement with that third-party provider, very similar to the way that you're doing for email. And it's the same thing with WhatsApp or Facebook Messenger as well.
Great. And someone in our audience is asking about counselors texting patients to remind them of appointments. Is that an issue? Is that going to cause some trouble?
So if you're just doing patient reminders, that is not an issue. So the thing here is it's not that text messaging is not outlawed by HIPAA. It's the transmission of that protected healthcare information that is regulated and watched by them. So if you are just doing it for appointment reminders, that's not a worry. What we say is if you're already texting with them, upgrading to a new platform where you could speak very transparently about, how treatment is going, how did the session go, X, Y, Z. You can get a lot more information transparently with that. But, if you aren't transmitting electronic PHI, it's not the text messaging at fault. So, you are able to continue to confirm those appointment reminders via text messaging.
And I know there are some rules about organizations when they need to disclose breaches. Would they need to disclose breaches if it involves this type of text messaging?
Yeah, especially if what we found, self-reporting usually leads them to working with you to remedy the problem. But if you do have a employee that had their phone hacked, that sort of thing, and they know that they were texting around patient data, we would kind of recommend reaching out and letting them know that happened because if you go back to like the 42 CFR Part 3. If you had a text message that you could identify, you said something about the patient and their name, and then, specifically around, the drug and or alcohol abuse that they've had in the past, if that gets online somewhere, they could possibly have their name tarnished, really for good out there. And so being able to alert someone that occurred, we sort of highly recommend.
Okay, and let's finish up with one quick one. You had mentioned 42 CFR and that it does address texting. But what about the specific disclosure forms that the patients are actually reading and signing? Should those specify that texting may be used?
I believe you can disclose that texting can be occurring. So it is really many times up to the patient around who can and cannot use insecure modes of communication with their patients. I mean, what we would recommend highly is, deploying a system like this, just because even if the patient authorizes insecure communication around their data, they might not fully understand the repercussions if that information is released. But the patient does have full access to authorize third parties to communicate at will and as they'd like to around their patient data. And this is the patient disclosing to the healthcare provider who can and can't communicate around their electronic PHI.
Well, that's great information. And can you finish up also by giving us maybe one word of caution, maybe one mistake to avoid?
Yeah, I think the biggest thing here is just understanding, how delicate it is with the patients that you're handling. They are sort of coming to you many times, at a low part in their life, and I think it's sort of everyone's duty here to do the best they can to ensure that not just the patient's being treated well medically and clinically and mentally, but also that you are handling their data well. So you can sort of get by with doing initials. You can ask the patient to allow you to disclose it, but when you are talking with a sort of a low cost solution that can ensure full compliancy, full encryption, we'd really recommend at this stage in time, looking into solutions where you can provide, security and peace of mind to everyone out there, because technology is moving quickly, and it can drive a lot of productivity and benefit to your organization if you take a closer look at it.
Well, that's really good advice. Thank you for that. That is all the time that we have for questions today, and I do want to thank Michael DeFranco once again for an excellent presentation. I would also like to thank our sponsor, Lua, for making today's program possible. Finally, thank you to everyone in our audience for participating today. We do hope you'll join us again in the future for another Behavioral Healthcare Executive webinar. This concludes today's presentation.